we're going to talk about how to reduce medication errors in our EMS practice. Hey everyone, I'm Steve, Paramedic Instructor Coordinator. Every year, thousands of patients are either injured or die as a result of medication errors. In addition to the obvious monetary costs, patients also experience physical and psychological suffering due to medication errors. A major, possibly unrecognized consequence of medication errors is that it will lead to a decrease in patient satisfaction. It will also grow a distrust in the healthcare system. So what are medication errors? Well, these could be things like improperly giving the medication at the wrong time, administering an improper dose, administering an improper route, could be improperly preparing the medication by either using the wrong diluent. This could be using an expired medication by accident. We should also consider assessment and history taking errors. These could include not getting the patient's allergy status or not reevaluating our patient following a treatment. So what causes medication errors? Well, giving an expired med could be because our medications aren't stored properly. Maybe we're not setting the appropriate rate when we give our medication. Improper preparation could be because we're not checking the diluent and its compatibility with our medication. Possibly the wrong dose because we're not double checking our protocol or our med math isn't correct. We also may not be considering a patient's allergy status or looking at the contraindications for these medications and our patient assessment. Distractions are also a big factor when it comes to medication errors. Now, EMS itself is chaotic and unpredictable, so there's not a lot we can do to change that. But if we're aware that distractions can impact our choices, we can stop, take a breath, and make a good decision before giving a medication. Let's talk about the 5 rights of medication administration. What are the 5 rights? The 5 rights are several steps that we can follow that will help us reduce medication errors and provide our patients with the best treatments possible. Right number 1, ensure we have the right patient. If we're dealing with multiple patients, make sure that we're confirming the patient's first and last name. We also want to know the patient's age and their date of birth. This could be because we have medications that could be contraindicated in certain age groups, be it that they're children or elderly. We also want to make sure that we're using the correct dose. In pediatric patients, a lot of times our medications are going to be weight-based, where their adult counterpart is not. We also want to make sure that we're looking for patient's allergy status. Can this patient take this medication? Right 2, ensure this is the right medication. Confirm the medication name. Is this the medication that I meant to grab? Also check for any damage and clarity of the medication. We should also be checking our concentration as well. Just because we're used to one concentration being supplied in our drug box doesn't mean that that hasn't been replaced in the pharmacy. We should also be checking to make sure that this medication is not expired. Rights 3 and 4 kind of go hand in hand. This is ensuring that we have the right dose and the right route. To do this, we want to make sure that we are verbalizing the dose and the route that we wish to use. And also remember, some medications have different dosages depending on which route we're going to use. As silly as it sounds, saying it out loud and hearing your own thoughts helps your brain do a double check and recognize if there may be a mistake. For best practice, we want to cross-check our medications with our partner. To do this, our partners should read out loud the medication name and the concentration and the dose. They should also check for expiration and make sure that they are confirming the volume that is being administered and the dose being given by the primary provider. Right 5 is ensuring that we have the right time. If we're giving multiple doses, has enough time elapsed since our previous dose? Also, is this the appropriate time for this medication? Is this the most pertinent treatment for this patient right now? For instance, if I have an apneic patient, should I be reaching for that BVM instead of giving them a medication? There are also other rights besides the 5 main rights that you should be aware of and also consider using in your practice as well. One of which is the right knowledge. Can you state the indications of this medication? Can you confirm that there are no contraindications for this medication? Do you also know the side effects? And are you aware of any potential problems that you may have to treat? We also need to think about the right documentation. Yes, we can use the drop-down boxes and select the appropriate medication, but in the narrative, can we also describe what our thought process is, especially if our treatments are slightly outside the box? Do the right assessment. Is the assessment that you've done on your patient indicating this medication? And also, are we reevaluating our patient after our treatments? We also need to think about the patient's rights. The patient has the right to be educated. Do they have informed consent? They have the right to know what it is that you're doing for them, what the medication is, what the treatment's going to be, and what are some potential side effects. They also have the right to refuse our treatments as well. Remembering all these rights can be challenging. So I like to ask myself before I give a patient a medication, is this patient being pampered? And what does pampered stand for? P is for patient. Is this the right patient? Do they have any allergies? Do they have any contraindications? Is the patient the right age for this medication? A is for the amount, or making sure that I have the correct dosage and confirming that with my partner and the protocol. M is for medication. Is this the right medication that I meant to grab? Is it in good condition? Is it expired? Is it also the right concentration? The second P is for purpose and preparation. Is this the right medication for the assessment? And also, have I prepared this medication appropriately? E is for event. Is this the right time for the medication? Is this the most pertinent treatment right now? And if this is another dose, has enough time elapsed since the previous one? R is for route. Is this the correct route? E is for education. Is the patient educated on the risks and benefits of this medication? Do I have informed consent? Are they also educated that they have the right to refuse this treatment? And lastly, D, make sure that we're documenting our medication administration. As an individual, using the 5 rights of medication administration is great. But really, to hit a home run, we need to tackle this from an organizational level. The best practice would be to be able to adopt a reporting system that's non-punitive and educational. We should have a system in place where reporting medication errors and even near misses is encouraged and is without repercussions. We can then use this information to help stop similar events from occurring in the future. This is also a great learning opportunity and enhances safety. Thanks for joining me, and remember, by using our 5 rights of medication administration, we can elevate our patient satisfaction and increase the trust the public has in EMS. Thanks for watching.